everybody, and welcome to another episode of Fun Facts at the Pharmacy. I'm your host, Dr. Christopher Greider. If you weren't here for the last episode, which was our first episode, the purpose of this show is to guide and give you guys some general health information to help you make the best decisions about any health-based decisions you need to make. And especially if you don't have a healthcare provider there for you, this way we can kind of give you something to work with. The beginning of our show, we normally start off with something that I like to call fast acting. The idea is that we give you little segments of things that are current with the news that's going on right now or current events that are happening, so that way you guys can be familiar with what's going on around you. The beginning of the show, I just want to kind of talk about some really interesting things that I come across when we're talking about national days. So when I say that, there's days dedicated to different things. So we're talking National Taco Day, National Churro Day. In case you guys didn't know, November 22nd is Go for a Ride Day, so I hope you didn't miss that. And November 23rd is Your Welcome Day, as in you're welcome for bringing you the show because we're here to help you guys out. But there are some important days and events that are coming up, and months in particular, that happen. So if you aren't aware of it, in October we actually have National Breast Cancer Awareness Day month. So the idea behind it is to give you guys an idea to make sure that you're getting checked out, especially for all the women out there, because breast cancer is a very severe thing. November is actually a month in which we dedicate to actually doing for prostate. So as you can tell, I actually have all this facial hair here, which is not normal for me actually. But the purpose of it is it's No Shave November. The main thing behind that is it's meant to show the facial hair and hair that cancer patients are unable to actually grow themselves. So that's why they started this. So if you see a lot of men that start growing random facial hair on November that normally don't, you can kind of talk to them and ask them about it, because they're ideas to help you understand that cancer is very severe, and we want to make sure that everybody's aware of it, and to help raise money, because these are diseases that we want to try and either get rid of if possible, or at least help people in the best way to live the longest life possible. The other name that November goes by also is Movember, which was established from the word mustache and November being put together. That's actually meant to help with men's health in general. So we're talking about prostate cancer, testicular cancer. These are all very severe things, and when you think about it, a lot of people don't realize how important both of these cancer states are. With breast cancer, about 1 in every 8 women at some point in their life will be diagnosed with it, whereas with prostate cancer, 1 in every 7 men will be diagnosed with it. Now, you'd say, you know, why aren't we pushing more for men's health then? The problem with it is that the survival rates tend to be different. So women that develop breast cancer, most of the time, if it's found at least early enough, there's an 86% survival rate going about 10 years out from when you get diagnosed. With men, 96 to 100%. So it's not nearly as severe, but more men will be diagnosed with it, is the concern with it. If you break that down, we're looking at crazy numbers. So back in 2014, they found that there were 125 million women in the United States. So if you're thinking this isn't relevant to you, that's about 15.6 million women will be diagnosed at some point in their life, which is a crazy statistic. Same with men. We're looking at 119 million men in the United States as of 2014, and about 17 million of those men will actually be diagnosed with prostate cancer. The main point that I bring up about this is because I want you guys to make sure that you're going in for your yearly checkups. Now, for most people, typically around the age of 40 is normally the point where they want you to do it every single year. If you're an extremely active person, and especially for young teenagers, they want you to get a physical to make sure that, you know, participating in sports or doing activities aren't increasing the likelihood of causing any further problems. So it's not a bad idea to get those done, and they are required by most high schools as well. And the other thing is, the sooner you find out about these disease states, the easier it is to treat. For a lot of people, they don't understand, if you wait too long and the cancer progresses, you're getting to the point now where your survival rates drop to the 20 to 50% chance, which is ridiculous when you can simply be anywhere in the 96 to 100% to start off with. So we want to make sure that you guys are going out and getting your physical checkups every year, unless you have other disease states that would be concerning. So we're talking about things like asthma, COPD, diabetes, any kind of heart-related conditions. All of these things play a big role in it. So if you do have any of those, it's not a bad idea to make sure that you're getting an annual checkup, regardless of your age. because we want you to be as safe as possible and to live the longest life possible so that you can be there for the ones that you love. The other thing too is that we have Diabetes Awareness Month that actually occurs during November. So if you are diagnosed with diabetes, make sure that you're keeping track of your sugars so that we can kind of keep a good eye on you. A lot of people don't realize with that type of thing. It'll be something we'll dive into later on in a further episode. But the main thing is with diabetes, you don't see the long-term effects until it's too late. And that's the concern there. And the last thing that we'll talk about too is that December 1st, I hope you guys are aware, is AIDS Awareness Day. The idea is that we want to make sure that everybody's safe, and especially if you're being very active with your love life, we always want to make sure that nothing bad's happening to you. So make sure that if you have any doubts or questions, that you're asking your doctors, asking your pharmacists, just talking to your healthcare providers, just to make sure that you're getting checked out if there is any kind of risk, or if you start to notice anything unusual with energy levels or just feeling weak or getting sick quite often. We want to make sure that you're doing that just to make sure everything's great. Besides that, the main portion of our show today that we want to dedicate is it's cough and cold season. Yay! Everybody's so happy about that. So I've had a lot of people coming up already that are either dealing with seasonal allergies or they're getting sick right now and they can't tell the difference. So a lot of people go to their doctor's office and they want to get an antibiotic. That's the first thing that they want to do is say, I want an antibiotic right now to treat something. But the reality is not every single condition is going to need an antibiotic for you. The main thing is that antibiotics are typically used for bacterial infections, which are a different string of problems. So to kind of help talk about that a little bit, I actually have a student with me here from Neomed. Her name's Christy. So go ahead and introduce yourself, Christy.
Hi, I'm Christy Hartline. I'm in my last year at Neomed, and I'm here to talk to you guys about antibiotics.
Perfect. Yeah. So the idea behind this is with antibiotics, we want to make sure that everybody's kind of aware of, what are they exactly, who needs them, what are some of the concerns associated to them. There's a lot of topics that kind of spring from this. So just to kind of start off from the top, Christy, can you kind of explain a little bit just what antibiotics are in general?
Absolutely. Antibiotics are medications that inhibit the growth of organisms, and organisms in this case are bacteria.
Okay.
And there are different types of antibiotics that work on the different types of bacteria.
Okay.
So we'll be showing you an image. Yeah. And in this image, you can tell that it's very complicated, all the steps that are involved in the bacteria. What this particular image shows is that there are different ways for the antibiotics to work also. Some cover more of these, some cover less of these, and some are more specific where they just target one.
Yeah, so as you can see from the image as well, that's the main thing. There's different compartment, so to speak, of a cell, because you can tell this is just a basic bacteria cell. They're very complex, so you can only imagine what a human's is like versus an actual bacteria's. We have to find different ways to target them because different bacteria are able to fight different antibiotics and affect us in different ways that we want to be on the safe side. So that brings up a really good point that we want to make sure that we're hitting the right spots on that bacteria so that we can get the best health possible out of it. So give us a little bit about antibiotics. When were they first found? Give us a little bit of history on that.
So they were founded by a gentleman named Alexander Fleming. He is actually a professor of bacteriology at St. Mary's Hospital in London. And in 1928, he returned from a trip to Scotland. Mm-hmm. They call it a holiday, but we'll call it vacation. He found in his petri dish there was something that had stopped the bacteria from growing. And upon further inspection, he realized that it was penicillin, and he also recognized that it was similar to the mold that grew on bread. And what was actually in the petri dish was strep. So if you hear the word strep, that's how they found it. They literally were growing it on those little dishes, and there was a spot where there wasn't any, and they treated strep with penicillin.
Yeah. I was going to say, I wish I could just randomly stumble across something that just magically disappeared. I would safely say money does that all the time, but can't always stop that. So yeah, so that pretty much kind of covers a little bit of that. The main thing is when we talk about bacteria, we're talking about there's different types. So you kind of mentioned one right now. We're talking about strep. Are there any other ones that kind of come to mind for you?
Yeah, there's staph, there's MRSA, there's Pseudomonas. There's plenty of different types of bacteria, and some of them are more antibiotic resistant than others.
Okay. Yeah. So with all the different types, I mean, you're talking about a little bit about penicillin there. The main question that I have then, and I know a lot of people tend to ask me about this as well, is there, why am I not always given the same antibiotic then?
So you're not always given the same antibiotic because in different types of the body, we have normal flora. Your skin has normal flora. You have different flora in your mouth than you do in your esophagus. So depending on where the infection is will help the doctors to figure out which type of antibiotic to give you.
Okay. So depending on the locations really helps to kind of dictate what we're going to treat it with then.
Yeah.
Okay. Yeah. The main thing that I always have that people ask me questions about is, why is it that with the general cold, so when somebody comes in saying, oh man, I have this horrible head cold, or oh man, I feel like I just have a cold right now, but they get upset about it because they're not given anything at the doctor's office. Why is that?
So the main reason you're not given something for everything in the doctor's office is it could be caused by a virus. So rhinovirus, for example, is not a bacteria, cannot be treated with an antibiotic. So you won't get an antibiotic when you go in and they say, oh, you have a virus. It can't be treated with an antibiotic.
Okay. So you're saying that antibiotics essentially don't target anything that's like a viral or fungal infection then?
Correct.
Okay. So that kind of further explains mostly as to why, when anybody has a cold, most of the time what we normally tell people is you just have to simply treat the symptoms. So you don't get an antibiotic for a reason because it's not going to actually touch anything, and instead you increase the likelihood of possible side effects or anything that the medication could do to knock out that normal flora that you're talking about. That can always lead to some problems there. So it kind of leads me to wonder, what are some major things, because there's so many different antibiotics out there and everybody's body's so different. What are some of the things that you would ever want to tell somebody about that was actually getting an antibiotic?
So there's a couple things that I would talk about when someone starts a new antibiotic. For example, you may have diarrhea, and you may get that because of an antibiotic doesn't just target bad. It affects the good and bad bacteria, so the good flora and the bad flora. And in the case of diarrhea, it gets rid of it, and it can cause you to have diarrhea. So I would also tell them to try probiotic if they get that.
Okay.
I would also tell them to make sure to take it with food because it can cause upset stomach.
Okay. Yeah. The only other thing that I would say, at least in my experience, is just to make sure that people are thoroughly taking their antibiotics all the way through. The number one issue that I run across is that, the antibiotic was written for, say, 7 days. The patient takes it for about 3 days. They start to feel better because it knocked out whatever was causing a problem for it, whether it was something like pneumonia or whether it was just simply like something in their gut that was bothering them, any of the bacteria that was in there. So it knocks that all out. But the problem is when you stop taking the antibiotics like that, it leads to an issue where stuff becomes resistant, so to speak, because you're not giving it the full treatment. All the bacteria is not being knocked out like it's supposed to, and that's causing a rise of something that we call antibiotic resistance. So antibiotic resistance is actually a big thing. So can you kind of tell me a little bit about why that it would be a concern for you?
So the first thing you already stated is that antibiotics, if they're not completed, may not kill all of the bacteria. So say there's one little bacteria that's left behind, he now knows what his typical antibiotic's going to feel like, and he can resist it in one of the many ways it's possible. So in order to combat that, patients need to complete their antibiotic therapy as directed by the physician. And then what else can happen is if you end up with one of those antibiotic resistant bugs, you will have more trouble finding an antibiotic to actually treat it. Okay.
Yeah, so that brings up a really good point, and it's something that even the World Health Organization has brought up, which is it's WHO, which I always thought was a funny acronym there. But they have brought up the fact that as of 2013, there's one drug in particular that we had that was the nuke, will blow it up, which is I believe it's called Callista. But the idea behind it is that bugs started becoming resistant to it around 2013, which now leads to a concern, because if any antibiotics are unable to treat any of the bugs, this is where you have problems where things can go rampant. The big thing that a lot of people like to talk about is with the flu shot in particular, viruses and bacteria work a little differently. So the main thing was with flus, there's a lot of mutations that occur. Mutations are a lot different than they are in regards to bacteria. So the big event that everybody knows was H1N1, where there was a mutation that occurred amongst a viral strain, because mutations that happen where the virus itself learns to change its coding so that the flu shot doesn't become as effective because your immune systems aren't ramped up for it. Antibiotic resistance, on the other hand, is these bugs are legitimately learning how to fight off what we're trying to treat them with. So we want to make sure that, with all of our patients, you're not helping to further the problem, so to speak. We want to make sure that you're putting in everything that you need to make sure that we're fighting off the bug, we're killing everything off, and that nothing is left behind to adapt to it. As that picture that we showed you earlier showed, there's so many different ways that we can go about fighting bugs. The problem with it is, if any of those start to become eliminated, we're selecting our choices down to a point where maybe there's only one or two things that can happen. There are certain things that you'll hear that do occur at certain places like the hospital. So MRSA would be a good example for that. Can you tell everybody a little bit about what that is?
So MRSA is a methicillin-resistant Staph aureus.
Okay.
Basically, that bug is absolutely resistant to all penicillins.
Yes. Yeah, so that's kind of a concern when you start hearing these terms where there's MRSA, there's VRSA, there's different acronyms that are essentially talking about all these resistances. We're going to hit a point here where essentially we need to come up with more drugs to kind of help treat. And the problem is that even from the standpoint of pharmaceutical companies, and that's the hardest thing right now because they're the ones that help to control what we come out to the market with, they don't see a huge profit in that, and that's where part of the problem is. It's the greed versus the help. We need to find a point that kind of balances that out, because most people are on antibiotics for, say, 5 days, but most people are on their blood pressure or cholesterol medications for years to months to maybe their entire life ultimately. Mm-hmm. So we want to make sure that we're trying to prevent the need for more antibiotics, because it's hard to say how these companies are going to go about creating them. But with all the changes that are occurring right now, as long as everybody's kind of keeping up with that, it really does help out quite a bit to prevent the problem from getting any worse than it is. And hopefully one day we can kind of eliminate it so it doesn't become a problem anymore. And they have been finding that some superbugs right now are actually becoming more susceptible. So a lot of these old penicillin-based medications are actually reemerging because they never developed the resistance to it. The coating's not there, so it kind of works out in that regards. Another point that you brought up from earlier that I thought was really good was probiotics. So I'll be honest, I have people that come in all the time. They're asking about different herbals, but in particular, probiotics tends to be a really hot topic right now. So I kind of wanted to see what you knew about probiotics so that you can let us know.
So probiotics are replacement for the good bacteria. Basically, you take them in conjunction with your antibiotic, or you can just take it regularly to keep yourself full of the good stuff. Yeah. And it is to help reduce the risk of getting what's known as C. diff. Okay. And if you don't know anything about C. diff, you don't want it. It smells and it's horrible.
Yes.
But the information that I have found stated that it will reduce that risk, and it can actually kind of level people out if they take it regularly.
Yeah. So exactly, kind of just backing up what you're talking about, yeah, that's typically what the probiotics are used for. Now, the question that I normally get is there a set number? Is there a set amount? Because if you pick up one bottle of, acidophilus, you'll see those listed somewhere. That's just one probiotic of the many that are available out there. You'll see, these CCFs is what they call them. And what they're talking about is colonies per amount, so to speak. It's the easiest way to break that down. But what we're looking for, and what they found, and at least according to the American Association of Family Physicians, what they have found is The set number varies depending on who we're talking about. So with children, we're looking anywhere from 5 to 10 billion CCF is what they're looking for. That's what's been mostly studied, so that's what provides the most help for everybody. So at least with kids, that's what we're looking at. With adults, it ramps up a little bit. We're looking from 10 to 20. So make sure that you're getting the correct amount, because there's so many different ones that are marketed out there. And even if you ask the pharmacist what their recommendations are, it may vary according to what products they have available. So what I normally tell people is make sure that you're reading your labels. That's the biggest thing. On the back of all your bottles, they will have to state exactly how much they have per capsule or whatever it is. And then make sure that you're getting the proper serving size too. So all of that stuff will be on the back of the label of the bottles, just to make it easier for you. The other thing too that we always want to talk about is potential side effects, because we want to make sure that people are getting the best help with it. When we're talking about side effect purposes, the nice thing about it is that with probiotics, there's very minimal. The most that anybody can possibly deal with is slight discomfort. So that's one of those things that it's more of like a GI kind of like stomach upsetness, so to speak. But that's mostly just because if you overload your body and just pump yourself full of probiotics, you're increasing the bacteria. And to be honest, the reason that we produce gas essentially is because of the bacteria that are in there. When they process everything, it releases gas, and ultimately, you know, that's what causes essentially flagellants is what they say. So we always want to be on the safe side about that. So just make sure that you're keeping it within that 10 to 20. The other big use for it is during our antibiotic use. So one of the studies that we've looked at so far actually showed that the use of probiotics with antibiotics is not bad. Like Christy had mentioned, the probiotics is good flora, so it's good bacteria for your system. The problem with antibiotics is that it'll knock everything out, both good and bad. So we want to put the good back in there when we're knocking out the bad stuff that's causing the problem. So for a lot of customers and a lot of patients that I've talked to, if you use a probiotic with an antibiotic, it helps to kind of offset that, so that way you're not dealing with as much discomfort, and it makes the process a lot easier for the next few days. Yeah. Besides that, in regards to duration, you know, how long do people normally use antibiotics for?
7 to 10 days is typical, but I've seen as much as 14 or 21 too.
14 or 21, yeah. Yeah, so most people, they always get concerned about it where, you know, we're having different antibiotics and we're using different amounts of time. But the reality is sometimes we can actually, the durations can increase. So don't be concerned if your doctor switches your medications. A lot of the times with antibiotics, the nice thing about it is we'll normally try to treat something beforehand. So if they think that you have a particular bug or a particular problem, they'll treat it accordingly. So if you go into your doctors with really bad cough and there's a possibility that it could be, you know, pneumonia, they'll give you the antibiotics that are used to treat that. However, a couple days later, they sometimes will do cultures and tests. That's their way of figuring out what exactly you have, and then they may make your therapy more selective if that particular antibiotic doesn't actually hit what it is that's causing the problem for you. So never be concerned. Always talk to your doctor. Always talk to your pharmacist if you have any doubts or problems with it. We're here to help you guys out. We're here to make things a little bit easier with the transition. And then if you have any doubts about probiotics or concerns, there is some research that's out there. They're still working on studies, but we haven't quite gotten to that point yet to find the right recommendation. I hope everybody had a great Thanksgiving, and I hope you all have a great Christmas if we don't see you before then.